absolutely, absolutely wonderful
Okay.
on the breakfast thing the other day. You were amazing.
Thank
Okay,
you.
colleagues, we are live. I'd like to welcome everyone to our electronic Board of Health meeting. Due to the COVID-19 pandemic, Regional Council is practicing physical distancing. I am present in the council chambers. All other councillors are participating electronically. I would like to acknowledge that the land on which we gather virtually today is the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral people. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements, and their contributions to our community. What I have learned from Indigenous peoples is that our relationship to the land should be one of stewardship, not ownership, and I'm honored to make this journey with them. I would now ask the clerk to do roll call.
Chair Redmond.
Present.
Councillor Armstrong. Councillor Clark. Councillor Erb.
Present.
Councillor Foxton.
Present.
Councillor Galloway.
Present.
Councillor Harris. Councillor Jowett.
Present.
Councillor Jaworski.
Present.
Councillor Kiefer. Councillor McGarry.
Present.
Councillor Nowak.
Present.
Councillor Shantz.
Present.
Councillor Strickland. Councillor Verbanovic. And we have regrets from Councillor Lawrence. Thank you, Chair.
Thank you very much, clerk. Are there any declarations of pecuniary interest under the Municipal Conflict of Interest Act? Seeing none, I would now invite Dr. Wang to give us a COVID update. Welcome, Dr. Wang.
Thank you, Chair Redmond, and good afternoon, Council. Kathy Prosh will project my slides. Thank you, Kathy. So I'll start with my key messages, which are on slide 2. Q. So 1, our hospital and high-risk settings, such as our long-term care and retirement homes, continue to be under tremendous pressure due to a very high number of outbreaks and a very high number of staff who are off ill or who have to self-isolate. 2, vaccination continues to offer strong protection against severe illness. And 3, early signs of a possible plateau in cases need to be accompanied with the utmost caution. If we go to the next slide, please. Oh, I'm sorry. I'll go by memory. I think memory is all right. There are currently 76 outbreaks in high-risk settings across Waterloo region. Just going to see if I can pull potentially a backup page up so I can refer to the numbers. Sorry, something has just glitched with my presentation and I can't see it properly. Should be up soon. So yeah, so as of Tuesday, we had 39 outbreaks in long-term care and retirement home, 28 outbreaks in congregate and other congregate settings, and 9 outbreaks in hospitals. All Waterloo Region hospitals are under tremendous pressure and are experiencing very high occupancy rates. What we're experiencing locally is similar to what's being seen across the province, which is shown on this slide, where the yellow graph represents hospitalizations and the orange graph represents ICU admissions. Our hospitals are reporting that patients seeking care are quite sick and most are unvaccinated. Our hospitals are actively working to open more beds in traditional and non-traditional spaces. Staffing those beds continues to be a tremendous challenge. Approximately 500 staff are currently impacted by COVID-19 and are either off because they tested positive or have to self-isolate. Fortunately, vaccination has resulted in mild illness for most staff and a faster return to work. Next slide, please. So the number of outbreaks in our high-risk settings is at the highest levels that we've experienced so far in this pandemic. Despite the number of outbreaks and the number of cases, the impacts on the most vulnerable in those settings, the residents, continues to remain much less pronounced than before those residents were able to be double and then triple vaccinated. The graph on this slide is taken from the Ontario Science Tables dashboard as of January 18th and shows the degree of protection the vaccines are having against infection, shown by the purple line, hospitalization, shown by the yellow line, and ICU admission, shown by the orange line. Two key takeaways are, one, protection against hospitalization and ICU admission remains high at 80% or higher. And two, protection against infection itself, represented by the purple line, decreased rapidly when Omicron showed up, but has recovered somewhat since more of the population has received a third dose. Last slide, please. Early signals of a possible plateau in cases, like what we have started seeing in our wastewater signal shown on this slide, need to be accompanied with the utmost caution. Ontario mobility data, released by the Science Table, also shows that Ontario's heeded the request to decrease contacts and that their overall mobility decreased. The efforts that our community made to get boosted and to reduce contacts helped to prevent even more severe cases and even more outbreaks. But we cannot let up on the brake pedal too quickly. We need to proceed cautiously and progressively with loosening measures that have helped reduce contacts and slow the spread. The impact to our healthcare system lags behind an increase or decrease in infections by a number of weeks, and therefore the pressures on our healthcare system will not ease until a few weeks at least have passed after the number of infections starts to decline in our community. We also need to do all that we can to keep schools open. I'm therefore asking our community to please continue to follow public health precautions while we continue to administer more vaccine to residents. Finally, I want to end by thanking our residents for all of their efforts in helping to blunt the most severe impacts of Omicron on our community. You are helping us get through this. Thank you. And I believe Vicki will have an update on the vaccine rollout.
Thank you very much, Dr. Wang. And Vicki Murray will give us a vaccine rollout update. Welcome, Vicki.
Thank you very much, Chair, and good afternoon, everyone. Thank you for the opportunity to join you with an update on our regional vaccine rollout today. I'll start with a review of our numbers. As of today, this is our vaccine regional dashboard update. We're now at 87.51% of eligible 5+ residents with a first dose, and 81.68% of eligible 5+ residents are fully vaccinated. It's 51.06% of children aged 5 to 11 years old have received one dose. Current data is showing that right now, on average, over the last month, we are doing approximately 400 first doses a day, with about half of those being for children. We are also seeing first dose uptake with the 18 to 29 and the 30 to 39 age groups. We've given 243,000 third doses, in Waterloo region. That's almost 32,000 doses more than at last week's council's update. 85% of our 80 plus residents have received their third dose, and 80% of 70 plus have received their third dose. Our estimate is that approximately 58% of all eligible residents have received their third dose as of yesterday. And there are about almost 13,000 third dose appointments still booked in January. We now have more capacity at our mass vaccine clinics than demand for doses. So we will be able to open up the Cambridge Pine Bush Vaccine Clinic for walk-in, no appointments necessary, for all doses, for all ages, effective immediately. That's based on clinic capacity. There are still booked appointments for children's second doses, which may affect the volume of walk-in doses that they are able to provide. Wellesley and Boardwalk also have a lot of appointments booked over the next 2 weeks for children's second doses. And we expect that once we are through those appointments, we'll to open up those two clinics to full walk-in, no appointment necessary as well. Our partners at Hourglass HR, who are running the clinics at 150 Frederick, are also welcoming walk-in patients for all doses and all ages based on clinic capacity. On a couple of dates, instead of operating out of 150 Frederick, the Hourglass HR team is running a clinic in Cambridge at 99 Beechwood Road. The dates for these clinics are Saturday, January the 22nd, Monday, January 24th, and Monday, January 31st. They are open to give doses from 9:30 a.m. to 8:30 p.m. The Binghamton's Clinic has been a great success, providing over 18,000 doses in the short time during December and January that it has been open. As the third dose vaccine rollout transitions from a mass clinic model to more of a community outreach model, we will be closing the Binghamton's Clinic and using our staffing resources to provide outreach clinics across our region, so that we can run more fourth dose clinics for the vulnerable long-term care and retirement home residents, so we can do more school clinics, and we want to provide additional community-based clinics. Our last day at Binghamton's will be this coming Saturday, January 22nd. There were about 200 appointments booked after Saturday, and we have already reached out to those people to rebook their appointments. Many thanks to the Binghamtons for hosting our clinic, and to all the staff who worked at Binghamtons over the holidays. Also, thank you to the community for your support at this clinic location and for getting to Binghamtons and getting your third dose. Our first during school COVID vaccine clinic is being trialed this week, and we are planning for more next week. Thank you to the school boards for working with us to pilot a new vaccination model in the schools. We will also be looking at additional opportunities for after-school clinics. Our goal is to provide easy opportunities to get children vaccinated and to provide the information parents need to get their children vaccinated. There is a great information resource and vaccination consultation service provided by Sick Kids, and along with many resources and informations, you can find that on our website. Please check out this information. We want people to get their questions answered, and we want them to get their children vaccinated. Today, I'd like to address a question that's been raised to me multiple times, which is, when can someone who has had COVID get their third dose vaccine? Do they have to wait a period of time? Recent guidance from the province is that people who've had COVID should absolutely get their third vaccine dose. They are eligible once they have completed their 5-dose isolation and are symptom-free. Even if you've had the infection, it is still important to get the third dose, as we do not have any data on if the immunity to the Omicron variant will extend to other variants or how long that immunity will last. I encourage this group of people to get their third dose of vaccine as soon as they are able. Many thanks to everyone in our community for getting your COVID vaccine. We are making progress together. Vaccination remains our best defense against COVID. Thank you.
Thank you very much, Vicki. Are there any questions on the vaccine rollout or of Dr. Wang? Councillor Galloway.
Madam Chair, I have a question for both Dr. Wang and Vicki. Dr. Wang, we're fortunate to some extent to be able to have those wastewater data, the wastewater data. So we know that hospitalizations trail cases by a certain length of time. Where does the wastewater data fit in on the kind of timeline? Does it tell us ahead of the cases or ahead of hospitalizations or behind hospitalizations? Like where does it figure in on the prediction scale, so to speak?
Yes, thanks for that question, Councillor Galloway. So it is a proxy for number of infections in the community. So if we start to see a plateau of the amount of signal in the wastewater, that signals that the number of infections, while still very high and much higher than we've ever seen before in the pandemic, isn't continuing to grow and is sort of stabilizing, so to speak, at the currently high levels. And if that's the case, then you would expect to see some impact on hospitals and high risk settings 4 to 6 weeks down the road. I mean, some of it may start a bit earlier, but some of it may be delayed even longer than that. So it's kind of a rough estimate of when you would start to see impacts on the hospital start to ease. If after this plateau case rates, which would be approximated by the wastewater signal, start to decline. So that's why, even if what we are seeing is a plateauing, and we'll have a better idea after tomorrow's wastewater update, because they are up. The update comes every week, Thursdays for now, and then in the weeks subsequent to now, it will be on Fridays. But we will have a better idea as we go through the next week or two. But if we start to see a plateau and then hopefully a bit of a decline, then the impacts to the hospitals will be 4 to 6 weeks later, in terms of really a significant easing of the pressures in hospitals.
Okay, good.
Councillor Galloway, do you have a question of Vicki?
Yeah, I do. Vicki, what is the school clinic going to look like in terms of, I've had a few people wonder, are we actually going into the schools and doing it during school hours? How do the parents fit in to the clinic, or is it after hours, weekends, or what does a school clinic actually look like?
Yeah, so glad to answer that question. I think we're approaching it as sort of two separate models. And we're trialing something new, which would be to go into the clinics during school hours, go into the schools during school hours. And in those clinics, the parents would not be there. We would work with the schools to provide information to families ahead of time so that they would get the consent ahead of time and the information that they need to be able to fill that out and to feel comfortable providing consent for their children to get vaccinated. We would have a small team set up in the school so that we can safely bring children to that team and vaccinate them. Like I said, this is a new a new initiative for us. We haven't trialed this with the COVID vaccine. We've done in-school vaccination before, but for other age groups. This is a younger age group. So we're, you know, as always, excited to try it. But we don't know what we don't know. And so we're going to learn and we're going to adjust. But we hope that this is effective for some families to get their children vaccinated. We're also doing the after school and weekend clinics at the schools. And those are the clinics that we're a little more familiar with, where we set up in a room in the school, but it's after the school has closed. And in that case, parents can come along with their children and be there with them when they're getting vaccinated. So it's a very different model for that. And we're really hoping to be able to increase the number of after school and weekend school clinics that we're able to do.
Okay, thanks. The other question for Vicki, Madam Chair, was is there any update on the Pfizer availability issue? I mean, we have lots of vaccine. We don't want people vaccine shopping. Moderna is fine for a third dose, but do we know whether or not that situation is changing, or is that likely to carry on for some period?
We're still not 100% sure on the timeline for a big supply of Pfizer. We have been able to get small amounts of Pfizer delivered to our community. I think it's about 3,500 doses in the last week, which really isn't very many, and is why it is being reserved for the 18 to 29-year-old population. So, you know, we're hopeful that there may be more in the future, but the timelines on that still have not been confirmed.
Okay, thank you.
Thank you. Councillor Shantz, please go ahead.
Thank you. A quick question for Dr. Wang, and I'm not sure if you can answer it. It's probably more even a provincial question, but I guess I have concerns about continuing to use number of cases as a metric when you're telling people not to get tested. And so when I hear the news, for example, that, you know, the number of cases are plateauing or whatever, I get concerned that people are misunderstanding what that really means. Are you making any, and you've always been really good, I think, at being, you know, very articulate in what the numbers do and don't mean, but are you making any inroads with your fellow colleagues or with the media?
Thank you for that question. That's an excellent question, Councillor Shantz, and my apologies. I could have been clearer. Our case numbers have been dropping for a while. They haven't only been plateauing, they've been dropping, but that's because of the fact that testing has been limited to only certain people in the population. When I refer to cases plateauing, I really meant the indicators like the wastewater signal. And also we are starting to see another signal appear, which I wanted to give a couple of days additional, I wanted to wait a couple of additional days to really use that. But one of the other signals that we've started to see drop is the percent positivity of cases. So among those that are tested, even among the limited group, the number that is being tested has started to decline. So that's quite recent, but it adds to the wastewater trend. And there's also the fact that we have a very, very high number of outbreaks in the high risk settings and in hospitals, but the speed at which new outbreaks are being declared has also started to slow. And what those three things that we're seeing with respect to wastewater, percent positivity, and the slowing down, so to speak, of cases and outbreaks in the high risk settings, even though they're very, very high right now, are what I meant in terms of being proxy indicators for the amount of cases in our community. So that's what I mean by plateauing, but I should have been clear. Our number of cases is no longer a good metric. And we continue to report it because we always have, and it's part of the picture, especially when you compare number of cases to the percent positivity. But you're absolutely right that it's important to make that clear, that the number of cases, which have been dropping already for a while, is not a good indicator of the true amount of spread. And we can't rely on that to, make assessments of whether or not the situation in our community is plateauing. So I'll be clear next time that we are continuing to use those other metrics to approximate, the number of cases in the community.
Councillor Shantz?
I appreciate the clarity, and it wasn't a criticism of your reporting. It was just sort of in general what's happening. So thanks.
Yeah, it's a great question. Thank you.
Councillor Foxton, I had your hand up and then it went down. Did you change your mind?
No, Councillor Galloway adequately dealt with it. Thank you.
Take a bow, Councillor Galloway. Councillor Erb.
Thank you, Madam Chair. I have a question related to the third dose, and just to make sure I understood what Vicky was saying. So since your last report to us, we've done another 32,000 third doses, and we have 13,000 booked until the end of the month. So to me, it looks like the number of third doses that we're doing is beginning to wane, that we're not getting the same concentration in that time period. Is that, am I interpreting that properly, or can you help me on that, please?
Yes, and thank you for asking for that clarity, because, like Dr. Wang, I perhaps didn't explain it very well, but I would tell you yes, that the volume of third doses that we're doing has been waning and decreasing. But we've done approximately 32,000 in the last week. That is a combination of what we're doing in booked appointments in our vaccine clinics, plus community pharmacy and primary care. So the extra 13,000 appointments that I referred to does not include any doses that might be done in primary care and pharmacy. So we will do those 13,000 plus probably another 13,000 in pharmacy, because they're doing almost 50% of all our doses right now. So the numbers are slowing down a bit, but it is higher than that 13,000 that I mentioned.
Thank you. Dr. Wong, you wanted to add something?
Yeah, I just wanted to quickly add that this phenomenon of decreasing demand is something that we're seeing across the province.
And then a second question, if I may, Madam Chair, related to the fourth doses that are being administered in long-term care. How's that going? There's an uptake there, or?
Yes, yeah. Absolutely a great uptake. We expect to have them completed by the end of the month. And there's quite a team working together to do those. It's definitely public health, but we're having partnerships with pharmacy, with the long-term care homes themselves, with NLOT. There's a very good team working together to get those patients looked after. Good.
And just to comment, if I may, Madam Chair, this is all great news, and thanks for all the work you're doing, but recognizing how it affects our healthcare system and the lag, we have to keep our thoughts for these poor folks in the front line and the implications that's going to happen with our healthcare system in the next 2 or 3 weeks. That it's not a pretty picture, and we have to do everything we can to mitigate that and to be supportive of the people that are providing that work, and patience and understanding that that's how the stress it's causing on the system and the people that are administering it.
Thank you, Councillor Erb. Councillor McGarry.
Thank you, Madam Chair. And my question was really related to vaccine as well. I'm kind of watching the numbers of how many people have had their second or third doses and the percentage of our over 5-year-olds, and it's just gone up just incrementally, slowly. I know that we're all trying to get out there how important it is to get that age group vaccinated and how important it is to continue to get vaccinated. Do you see any increased uptake with the, especially with the children's age from 5 to 11? And since you mentioned that some of the vaccine uptake now is sort of slowing down across the province, do you think that we're going to still struggle to try and get people in for their kids as well as their third doses?
Who'd like to take that? Vicky, do you want to go first?
Sure, I can start, and welcome to Dr. Wang if you want to add anything. This is top of mind, and I'm glad that you're bringing it up. It's what we are working on, every minute of every day. How can we get more doses in arms? I wish that it wasn't slowing, but it's also it seems to be a normal progression of the vaccine rollout, and we did see this with second doses as well, where mass immunization clinics are great at the beginning, and they get a lot of people vaccine doses very quickly. But that's not the best way to reach everybody. And that there's a transition point that occurs, I think, when we're doing that rollout, where we truly need to take the vaccine to people. And that is really what I'm seeing is happening in our community right now, that we're in that shift where we're taking the focus off of our mass IMS clinics and putting that focus on community outreach. And that includes the children in the schools. And it's one of the reasons I'm excited to be trying that during school vaccination pilot this week. And I'm very hopeful that is able to do more outreach as well for children's doses. So while we're seeing this here, as Dr. Wang mentioned, it is something that we're seeing across the province, but it does not mean that we're stopping or slowing down the work in any way, shape, or form. I remember this summer when the same thing happened. I talked about my foot's still on the pedal. We're pushing as hard as we can on the gas, and we are, but it's a bit different, right? We're changing the focus to more outreach and to less focus on appointments in the mass immunization clinics. Not to say that we're not going to still have many doses available in mass immunization clinics. We will, absolutely. They're a great way for people to get vaccinated, but we also want to look at other options.
Dr. Wang, did you want to add anything?
No, that was great. Thank you, Vicki.
I just would really like to underscore that Vicki Murray did such an excellent job about talking about regrouping and analyzing, and didn't use the P word once. Pivot was never a word that came out of her mouth. So not only was it a great answer, but great avoidance of a word that we've all used to death. Councillor Erb.
Just a comment, it is so gratifying to hear recognizing the shifts in the way people want to access vaccinations, and that staff are prepared to move with that and develop new strategic ways that we can meet the need in the community. So hats off to you for strategizing and recognizing that and being able to make the shift.
Thank you. Huge group effort, right? It's everybody doing it together. And I'm just so thankful for all the people who are helping me work on this. It never, no matter what I ask for, or no matter how hard or long the days are, everybody says, yes, we'll do whatever we can. And they're out there working. So I'm very appreciative. Thank you.
And I guess the only other thing, Councillor Erb, that I would add to that is, when Vicki and Dr. Wang talk about thinking and working on this all day, every day, they truly do. And it's easy to think that's just an expression, but I know that they start at 7:30 in the morning, and I'm often getting emails late at night. They absolutely give this their undivided attention, and they do have amazing teams working with them. I see no other question. Oh, that's just a thumbs up, Councillor Jowett, right? Thank you all very much. Vicki and Dr. Wang, thank you for what you do for our community. And if there is nothing further, I would entertain a motion to adjourn. Moved by Councillor Foxton, seconded by Councillor Bravanovich. Please use your icons to vote yes or no. That is carried. Thank you, colleagues, and thank you, Dr. Wang and Vicky. Everybody stay well.
Thank you.